Your health matters. Preventing sudden cardiac arrest through early screening is essential. And thankfully, we have a program here through UC Davis Health and other partnerships that are saving lives. So Rebecca McCormack, coordinator of Project Adam Sacramento, is joining us live to talk about this important event for our youth that is coming up. And Rebecca, thank you so much for joining us this morning.
Oh, thank you so much for having me.
So this was a bit of a startling statistic that we found. Every year, 23,000 children suffer sudden cardiac arrest in the United States. I think a lot of parents watching this are thinking, how is that even possible for kids?
Right. I know it is an astounding statistic.
Yeah.
It came out this year with the American Heart Association. They released that number. And for those of us who work in prevention, this wasn't a huge surprise. But 1 in 215 kids actually has a heart condition that puts them at risk for sudden cardiac arrest. And you think about, how many kids are out there playing sports every day and putting themselves in those kinds of positions. Like, you can see how these situations would arise.
What are some of the conditions that could go unnoticed or unchecked?
Yeah, there's a variety. So we've had a number of screenings now in the Sacramento area, and some of the conditions that we've caught are Wolff Parkinson White. We actually caught siblings with that condition, and that's a heart rhythm issue that puts them at risk, and it's completely fixable once they've been diagnosed. It also runs in families. A lot of these conditions run in families. We caught long QT syndrome, which is also a heart rhythm issue. The main one that you're looking for is hypertrophic cardiomyopathy. That's the leading cause of sudden cardiac arrest in young people. But what we saw with Bronny James going down on the court this year during his basketball practice, and we saw with when we saw them go down, you can see that these things do happen, and it's important to get your kids checked.
Absolutely. So this collaboration with Kyle J. Taylor Foundation, UC Davis Health, and Project Adam, I mean, it has been really successful. What was revealed during last year's screening in terms of how many cardiac events that you did catch before it happened?
Sure. Well, one of the things we actually catch a lot is high blood pressure, which is a really big surprise for most families to hear. But a lot of these kids come in with high blood pressure, so that's usually the first red flag that we'll see. But we've caught we've now screened over the last 3 screenings, we've caught we've had 1,122 young people screened between the ages of 12 and 25, and we've caught 24 conditions.
Amazing.
And
wow.
Yeah, so we not only do we have EKGs set up at these screenings, but we have echocardiograms available. Which is a really unique situation. In order to get referred to a pediatric cardiologist, you really have to have a history of symptoms out in our medical care and medical system. And so this allows us to sort of jump over that, because a lot of these kids don't ever have a symptom, or they'll have symptoms and not tell their parents. That happens a lot too, where they'll have symptoms of like shortness of breath, even fainting spells. And they don't tell their parents. They don't know that there's something weird about that, or the way their heart feels in their chest. And so by having them come to this screening, we catch a lot of kids where there may be no history or no history shared.
Now, Rebecca, real quickly, when is this next event for parents who really want to get their kids screened?
Yeah, so our next event is at Folsom High School on Sunday, April 14th, so just in about a month. We've got registration open now. You do need to register ahead of time. The screening we do, we take your vitals, we look at your family history. We'll do an EKG station, and then the physician actually will review it on site.
Okay.
These are all run by volunteers, so medical volunteers, not just from UC Davis, from the community that come and do this event.
And we are we're cut for time, but we will have those details on fox40.com. We will post this interview, and we will put a link to the registration so people can get that in before April when that event starts. Rebecca, we so appreciate your time. Thank you so much. Again, a very important event for our community.
Thank you so much.
Bye. Take care.